During CPR of an adult client, while performing the chest compression, the sternum will be depressed to option A 1 by 2 to 1 by 4 inch, option B 1 by 4 to 1 inch, option C 1 and a half to 2 inches, option D 2 to 2 and a half inches. The answer is option C 1 and a half to 2 inches. The compression depth at least 5 cm or 2 inches and the compression rate is 100 to 120 per minute. Which one of the following situation the rescuer use jaw thrust method to open airway? Option A, in all situations requiring CPR. Option B, if the client has history of epilepsy. Option C, if the client has a history of head injury. Option D, if injury of the neck is suspected. The correct answer is option D, if injury of the neck is suspected. Jaw thrust is a technique used where there is the strong suspicion of cervical spine injury. The aim of the jaw thrust is open the airway with minimal movement of cervical spine. Which of the following assessment data is relevant for a client with glaucoma? Option A, history of diabetes mellitus. Option B, history of migraine. Option C, history of chronic sinusitis. Option D, history of bronchial asthma. The answer is option A, history of diabetes mellitus. Glaucoma is a group of eye disorders resulting in increased intraocular pressure. Normal intraocular pressure requires a balance between production and outflow of aqueous humor. Normal intraocular pressure is 10 to 21 mm of Hg. Common causes of glaucoma are aging, diabetes mellitus, hypertension, trauma, ocular tumors, post-eye surgeries, and iritis. A nurse monitoring the intracostal drainage system of a patient with pneumothorax notes intermittent bubbling in the water seal chamber. The most appropriate action would be option A, inform the physician. Option B, check for air leak. Option C, document the observation. Option D, clamp the chest drainage tube. The correct answer is option C, document the observation. Intermittent bubbling in the water seal chamber indicate air leakage. It is normal in patient with pneumothorax when the patient exhale or cough. Continuous bubbling of the chamber indicate large air leak between drain and the patient. That time, check the drain for disconnection, dislodgement and loose connection. Then assess the patient condition and inform to doctor. Chest drain are used to allow draining of pleural spaces of air, blood or fluid, allowing expansion of lung and restoration of negative pressure in the thoracic cavity. Water seal prevent backflow of air or fluid into the pleural cavity. Indication of water seal chamber are postoperative. Example, cardiac surgery and thoracotomy. Pneumothorax, hemothorax, chylothorax and pleural effusion. While monitoring a child after tonsillectomy, the nurse observes him swallowing frequently. This indicates that the child is option A, feeling thirsty. Option B, recovering from anesthesia. Option C, bleeding. Option D, having pain. The correct answer is option C, bleeding. Swallowing frequently after tonsillectomy indicate bleeding. The immediate postoperative management is place the patient in lateral position to prevent aspiration. The nurse is reviewing the laboratory value of a patient scheduled for a surgery. Which one of the following result is unfavorable? Option A, FPS 84 mg per deciliter. Option B, hemoglobin 8 gram per deciliter. Option C, serum creatinine 0.7 mg per deciliter. Option D, blood urea 28 mg per deciliter. The answer is option B, hemoglobin 8 gram per deciliter. The normal value of hemoglobin in male is 13.5 to 17.5 gram per deciliter. In females, 12 to 15 gram per deciliter. Option A, FPS, the normal range is 70 to 100 mg per deciliter. Option C, serum creatinine, the normal serum creatinine is 0.6 to 1.2 mg per deciliter. Option D, blood urea, the normal blood urea is 15 to 40 mg per deciliter. The site selected by a nurse to administer an intramuscular injection to a 6-month infant is option A, vastus lateralis, option B, ventrogluteal, option C, dorsogluteal, option D, deltoid. The correct answer is option A, vastus lateralis. Vastus lateralis has a large muscle mass than gluteus and deltoid muscle and also has reduced risk of severe local reaction. Which of the following age group children engage in parallel play? Option A, infant. Option B, toddler. Option C, preschooler. Option D, schooler. The correct answer is option B, toddler. Parallel play, the child begins to play side by side with other children without any interaction. They are paying attention to each other.